Recording?
Okay. Yeah.
Good afternoon, Ashley.
Good afternoon. How are you, doctor?
Good, I'm very good. Thank you for asking. Okay, and how's your foot doing?
It's doing good. I've been doing the exercises.
Okay.
I've been having a little bit of pain though.
Ooh, what part?
In right next to the ACL and in my lower calf.
Okay, and on a scale of 1 to 5, how would you describe the pain?
I say a 3.
A 3?
Mm-hmm.
Okay. Now, it is possible that that pain is due, since you have been inactive for a couple of weeks due to your injury,
Yeah.
and that's just your muscle regaining. So, as long as the pain is not, overwhelming, then it should be fine.
Okay.
And have you continued the cross fiber exercises that I've given you?
Yes, I have.
All right. Remember that the fibers, they go like this, right?
Okay.
They cross each other. When something tears, they do rebuild, but sometimes they don't rebuild in the most organized way, and that could lead to for the tissue to break and scar more quickly than before. So that's why it is important to do those exercises in order to regain, the full function and strength of whatever tissue is harmed.
Okay.
And try to do that at least every other day. Don't do it every other day.
Okay.
Okay. And now, on your medication, do you have medication, or do you need me to prescribe you more?
Yes, I'm running low on it, so I do need a new prescription.
Okay.
Please and thank you.
All right, no problem. I will prescribe that to you. Okay, and I see that we are scheduled next Monday at 7 p.m. Is that correct?
Mm-hmm.
Is that still good to go?
Yes, sounds good.
Excellent. All right, so let me just finish up here. All right, and that is all for today.
I kind of want to ask you a favor.
Okay.
After injuring my ACL, I was interested in going into physical therapy.
Oh, very nice.
Yeah,
Very
so
nice.
I was wondering if I could ask you a few questions.
Go ahead.
Is that okay?
Go ahead.
The first question is, can you describe your education?
All right. Well, I started at Valencia. That was the first college I went to, Valencia College, and maybe 11 years ago.
Mm-hmm.
And I started there, and my first intention was to become a nurse, because I really like the medical field a lot. But after, further investigating, seeing all the things that nurses have to do, I realized it wasn't something for me.
Okay.
So I was a little lost towards what I would do. I did take this class called SLS, which is just a class, designed to help students find their strength and organize their, all their capacity and all things in order to find a career that suits them. And there was a little program that the teacher gave us. They gave us a list of jobs regarding, how they compared to our strength and to our personality. Now, after taking this specific test, I saw that physical therapy was on there, and after researching, I actually liked it a lot and decided that's something I wanted to do. After there, I continued, and I got my AA degree in 2 years. And which is a little fast, but it's doable. It's not too difficult. After that, I did Direct Connect to UCF, which is a program that Valencia offers. I probably still offers it today. That you can study, and once you do your degrees there, basically it's a road directly to UCF to continue any further study.
Okay.
In UCF, I did my 3 years, and I got a bachelor's in health science.
Okay.
Which is very difficult, I'll tell you that. And I recommend you to take your time. People will pressure you and telling you need to finish quickly, and you might want to pressure yourself in order, since it seems like a lot of years. But I recommend take your time, do good, because it will all reflect what kind of student you are, and if you're considered a good student for the physical therapy program. And the prerequisites are very difficult.
Okay. My second question is, what are the pros and cons of being a physical therapist?
Well, the pros, I would say, it's obviously working with the patients. You're given the ability to help patients to. It's fun working with the team too. So it's not an independent job. You do have to work with the team, and there's always an injury, but there's always amazing people that you meet. And once you help them, you be surprised with connections you form that can last a lifetime. The cons now, also working with people. Why do I say that? There are older patients that, by misfortune, injuries will never be, healed to the maximum again. Just because that's how the body works. After a certain age, the cells will not rebuild themselves, no matter what medicine or anything you give them.
Yeah.
And that usually results in, a negative attitude towards things. And sometimes they respond bad to you, and you wish you could help them more, but you do enough and you can. So that's the toughest part.
Okay.
I did forget to mention to you that after the bachelor program, the physical therapy program will take you around 4 years to complete.
4 years. Okay. Yeah. And did you take the DBT program at UCF?
I did continue it there, yeah. And it is very challenging, but once you're there, I can tell you it's doable. Okay. It has about a 96, a little less than that graduation rate of all students. The hardest part is getting in, since it's very competitive and a lot of students will like to be there.
Oh, okay.
So don't get discouraged and you'll be fine. Okay.
My third question is, what is your goal as a physical therapist?
As a physical therapist, my goal is not necessarily just to help people, but to give them emotional help as well. Because you got to realize that a lot of these people come with injuries that they realize they're not going to be the same person. They're not going to be able to walk the same or use things the same. So, you have to have that foundation to help them grow with you through the sessions, and in order to understand that everything is fine. Everything will be fine. And, I found that physical therapy provides a good, chance for that, for helping people and allowing to, because why do I say that? Because let's say you're in a emergency room center, people are going to come traumatized in the moment. They're going to have injuries, they're not going to listen to you, they're going to be in a lot of pain, and that is very difficult to deal with, and I have a lot of respect for the doctors that deal with that stuff. But in physical therapy, you're dealing with people that have already passed, the painful part, and maybe they're missing an arm, missing a leg, or in your case, they tore their ACL, and they want to regain, their full ability so they can continue in your physical activities. And it's challenging, but it's amazing. And my purpose is to give hope to the people and to help heal them, and to the extent of my power. Yeah.
Very nice.
Well, and I'm really glad that you like to do a physical therapy job, and I recommend to you, just really think about it.
Okay.
I don't know if they're still giving SOS classes, but you should investigate.
Okay.
Take it and make a clear purpose for yourself, okay? And this is something that is going to take a lot of dedication, hard work, and in the beginning of it, there's going to be a lot more negatives than pros. I can guarantee you that.
Okay.
But if it's something you want, at the end of the day, you will enjoy it and it will be worth it.
Okay.
All right, thank you.
Thank you for answering the questions for me.
And we are set for Monday night,
yes,
right?
Sounds
Just
good.
making sure. Okay.
Okay.
Right.
Thank you. Have a good night.
Thank you.